An 18 years old rock climber falls onto the left hand and sustains a large hematoma of the upper arm. Unfortunately, the wound associated with the injury is neglected and it become infected. Which of the following sentences is least likely occurs, or that means which is not occurs? First of all, the hematoma followed by formation of the abscess or infected, it is the acute inflammatory condition. It is the acute inflammatory condition. So in case of the acute inflammatory condition, we know different type of the substances increase and different type of substances decrease, or there is the definitive clinical feature of acute inflammatory condition. So which is not occurs in case of the acute inflammation? Here the options are axillary lymphadenopathy, leukopenia, tenderness, mild pyrexia, and local formation of the yellow pus. So what may be the option? So here we can see this one picture is enough for the acute inflammation, and of this question here we can see what is the acute inflammation. The acute inflammation is a short-term process occurring in response to tissue injury. It may be due to infection, inflammation, it may be due to physical agent, chemical agent, or radiation burn, or any type of the injury to the a specific area. And here the special feature, that means what is this the clinical feature of the acute inflammation. Here we can see first of all which is rubor, that means the redness, then swelling, warm or heat, pain, and loss of the function. They are the most important function. So what is least likely occurs? Here least likely occurs in the leukopenia, because we know the neutrophil or leukocyte, they are acute inflammatory cell. So in case of the acute infection, this neutrophil and other leukocyte, they increase. And axillary lymphadenopathy, which know when there is a inflammation in case of the specific part of the body, then what occurs? Reactive lymphadenopathy develop, or infection may spread from this local area to the draining lymph node and causes their lymphadenopathy, as it is the upper arm of the lesion. So in this condition, the lymph drain in the axilla and the axillary lymph node increase. Then tenderness is very, very important clinical feature. Then mild pyrexia, it is also true. And local formation of the yellow pus, it is also true, because there may be infection with actinomycosis, there may be infection of other important organism which causes the yellow pus, like moraxella. So in this condition, yellow pus also may be present. So only false option is the leukopenia, which is the reduced WBC. In case of the acute clinical inflammation, the WBC is increased, not decreased.